All right, guys. So for the longest time, I wanted to do this interview. I came upon Dr. Santos' work basically 4 years ago through her friend Sandra Kahn that she kind of worked with. And I feel like of everything that I've done and how much it's changed my life, like seeing you and your love for children and working with kids. And I just feel like it's so important that parents start as early as possible and they're aware of this. And I feel like anyone that loves to be around kids, like I can see your face and your smile, and it's like to be good around kids, you have to love kids. You can't fake it. It's like a horse. Kids know. So I feel like it's like I always see kids laughing and smiling, and I think you do an amazing job. And I feel like you are changing the game with how early you start with expansion and what you're doing and how many people in the United States claim that like you got to wait till they're 6 or 7. That's it. It's too hard. And it's like, so I wanted to have you on first, and I would love for you to just kind of talk about who you are, what you do, and we'll go from there.
Well, thank you. Thank you for this interview. I'm Marisa Santos. I'm an orthodontist. I'm an orthodontist. I'm a pediatric dentist, but at the moment, I'm an orthodontist, teaching orthodontics all my life in different universities and different careers in Argentina, Buenos Aires. I'm one of the chief of the Magister in Orthodontics at University of Buenos Aires, one of the most important magister around the world. I'm teaching it at the Argentine Society of Orthodontics. So I'm an orthodontics. So I live in Argentina, very far away, and not in a capital city. I live in Monte Grande. So it's something that was good and not so good for all the rest of the world, traveling, studying, and all that. But if I did all these protocols, everyone can do this. Everyone is able to do this. Any orthodontics is able to do this next week. It's so easy to treating kids.
So you've been doing this a long time. What made you get into wanting to work with just young kids versus, I feel like,
Well, it is
but
like a kind of a fairy tale story because I became a dentist very young, a mother very young. I get in love and I married and I have a lot of kids. And the younger, I received my orthodontics diploma with her in my thumb. And she grew and she was like this, inverted bite. And you know that for orthos, inverted bite or class 3 is something genetics. And I said, it's impossible. I have a father, myself, two other daughter and sister, and why this girl is like this? So my head started to like explode, saying this is impossible. So I start to create something in the mouth that no one taught me because, as orthodontics, they taught me to treat at the age of 8, to start at the age of 8, but I treat her at the age of 3. This girl now is a dentist. She had an only treatment when he was 3. I invented at that moment, but no braces. She is beautiful girl. She is part of the Argentine team of hockey. So a life changed for her because her mother treated her. But what about the other kids? My brother-in-law put a pediatric center, not dentists, pediatric center, doctors, and told me, well, you have to come. The pediatric center in Monte Grande, where I live, has 25 years. So the people that came to me, the patients, were not a grown-up patient. There were many kids like my daughter. And I saw like they were like going through the pediatric center to the ENT, to the Mayo, to the allergist, and so I said, oh, this is crazy. The same that I had to do with my daughter, my kids, no? So I started, I was not able to go to study, but when I finished with all my kids, I decided to go out and study because something was wrong in what I was taught. I never lived those kids like that. Although the securance there in Argentina says you have to start at 8, and the orthodontics said you have to start at 7, and early check-in is at 7. I've never lived a kid like that. Yeah. And after that, I have many kids every day, 5 days working, 40 kids in one afternoon. I start watching that they breathe better. But that was like a kind of, well, I did not make the expansion because of Airway. No one taught me that. Okay. So was when I first went to, I sold my car and went to study to London with Professor John New. And he told me, I show him, because I was 10 years orthodontics till then. So I show him my cases, my teeth. And he told me, you're stupid because you're an orthodontics. Not so stupid because you're here. I don't care about teeth. Show me faces. And that is here in my mind till the day I'll die, you know? So faces, airway, not teeth. And so that's the way I start with little kids.
Got it. Okay, so I think of like a John Mew as like Yoda for like, he's the all great knowing. So for those that don't know who John Mew is and what he's done for the world of airway and facial growth and treatment, like what would you say? Like, and I want to know about your experience with him, because I think he's one of the funniest people ever. And to watch him with his son gets so upset and he's like, he doesn't care. He's just like, yeah, we're not on a team. It's me and it's you. And he's like, that's the problem, Dad.
Yes, I went to study with him, but I told him he started at the age of 7. And I told him, no, you are not right. You have to start earlier. So I told him. But then it was a pediatrician, Maria Piabella, that incredible woman in Rome. When I heard her conference, because, I fight against the careers, the universities where I was. What are you doing expansion at these ages? And what are you doing? So I was like a kind of witch that was doing crazy things. I think that I'm a good witch. And Maria Piabella, a pediatrician in Rome, her conference, I was in Bordeaux, France, invited by an ENT, and she said, rapid expansion after surgery of adenoids and tonsils. And I said, oh, this girl is what I need, this woman. So now she's my friend. She will be invited to the symposium in Buenos Aires. So, well, that was my kind of, that's why I think that I have like a kind of magic path and I have to tell the world,
Yeah, your destiny. I love it.
Yes.
So I guess let's start with your daughter. You said 3 years old, kind of just started, you knew something was wrong. I think your your intuition, your brilliance kind of came out like, hey, this is what I'm gonna do. What did that look like for you when you started on that path?
I didn't know what I was doing at that moment, but yes, after 10 years, yes, and I think I was in a conference in Chicago because I start going to congresses of orthodontics for someone to tell me what to do. So how can I help all these kids that are coming? Um, and there was not a lecture of little kids in the orthos symposiums in the ortho meetings. So then I start something like different, going with Mayos, going with anthropologists, going with crazy people, no, like all you know, like Sandra, like John, like no one in my life came to me that was a normal people doing things.
Yeah.
But so the first thing I said it was that I saw a relation between malocclusions that people like Maria Pia Villa and Gilliminot, the father of in Stanford, they don't call that malocclusion. It's a craniofacial abnormality, no? So I think that that was getting worse and worse and worse. And there were many kids that had a malocclusion and they were breathing wrong. So when I went to study with John, I thought that everything was about breathing. Everything was about breathing. Then when I translate with Sandra, John's book, everything is about chewing, what we chew. So we have two things that are happening, chewing and breathing. And so the program I create is all about that. But well, we go to the second question now.
Yeah. Go ahead. I was going to ask you next. Yeah, like what it's as far as you getting into expansion for kids at such a young age, like what did that look like when you started versus like a now? Was that was it
You know
started
that,
with upper, now it's
yeah,
upper and lower, like
I started with upper and not because airway. I started because of a malocclusion. And then parents told me, oh, she is breathing better. And my brother-in-law tell the mothers, go there that she makes you breathe through the nose, making expansion. But it was not at the age of 3 at the beginning, because I think that this is changing dramatically bad. And so when I started, kids need treatment at the age of 6, 7. The canines were not fitting.
yeah,
Now we have kids, Sandra Khan's work, jaws. We have no space. We have no space for teeth, but we don't care about teeth. There's no space for breathing. And so I started going down and down and down in ages and creating appliances. I have
got
my
it.
own appliances. So, and when you asked me why do you think people are not treating kids at this age? I have no idea. No idea. No idea. Everyone must be doing this because it's so easy, you know. But we have things that we learn.
Hmm.
The early checkup in orthodontics is at the age of 7,
Yeah.
7. 7 for me is like, no. So the kid has grown and there's a good age for doing all these things, as it is beyond 6 years old. And but orthodontists are afraid of kids They don't want kids.
Yeah.
And so there's a problem because 3, 4, and 5 is of anyone, they have no owner, because orthos want to treat at the age of 9. Kids nowadays of 9, I said, no, go there. I won't treat them. In the magister that we have at university, I told the other chief 15 years ago, if we don't treat kids, every case will be surgery, a surgical case. And now we are 86% of surgical cases. So, no, we have to start, because we extract premolars, and I know what we will extract. Second molars, I know, because things are getting dramatically bad. They're not good, they're bad, So I don't know why. I know that it's chewing and airway, but dramatically. So we have to treat. The best age is the age of 4 years old.
And then so for parents that ask, like, if kids don't have all their molars or enough teeth, like, yeah, right. You figure it out, right?
That making an expansion and protraction in a 3, 4, 5 is like making orthodontic surgery. You don't go to the teeth, you go to the sutures. So this change is real in 1 month. 1 month.
Yeah.
1 month. You are not going to have appliances forever. So the protocol is 1 year, including everything. Then we talk about the protocol. But the appliances, that for me is the simplest part of all, is only 6 months. 6 months, only 6 months. So it's very easy.
So when you talk about this, here in the States, I think so many moms come to the game late looking for their kid, right? And it's, what kind of expander should I look for? Will you speak to, it's not the expander, it's the philosophy of the doctor, because if you're good at what you do, it doesn't matter what you use, you just figure it out. Like, I think it's important for moms to hear that, because they get stuck on this, like, I need Nike or Reebok or Adidas, anything else is off. And it's like, it's not about that. It's, I want to send someone that understands that it's all about posture and chewing and a good diet when we help a kid, not what they're doing in a tooth.
But the protocol you use for expansion regarding we are making now, because Maria Piabella, my master, my professor, made this with rapid expansion, the studies and the papers. And it's not the same expanding with every appliance. We need an appliance that helps in the craniofacial bones, So we need to go to sutures. It's not expansion of the palate. It's not expansion with anything. No. It's the protocol, and the appliance is also important. We are making, I have a dream team, because I have the best ENT in the world, and we are making a study.
Okay.
So we are making a study, and the differences between before and after nasal resistance with one appliance or another are very different. So
okay, got it.
we need to go to the nasal bone to open the sutures, to protract the maxilla. So that's why it's something that orthos have to do. It's very easy, but you have to do it. But it's not the same with every appliance. There are many appliances, that in United States, there are many people that told me, well, Marisa, I want you to be a speaker of this. And I said, you saw
No,
my
no.
case? You saw my cases? You think that with your appliance, I can treat those cases? Because I have the worst kids in the world. The kids that come to me, you know how they are. Vertical growth, not breathing. So I have to solve them really with a good orthopedic method. So in that's why they have to learn. They have to go to, I went to United States to teach Sandra. I was with Sandra in San Francisco. But it's more here in Latin America, in Poland, where they're doing the exact protocol that I teach. Because yes, the appliance is for one thing, one appliance, for the other, and that's some technical that an orthodontist has to know. But then it's a whole protocol what you have to do now. Sometimes you said a pupil from Peru came to my pediatric center in Monte Grande, and she told me, but the kid is not making collaboration. He's not. I don't care. This is the parents. This is a medical treatment. This is not something you ask your kid if he or she wants to do. This is something medical. This is now. This is not the same at the age of 7. We are not talking about teeth. We have an age that the vital functions like breathing are so important. And so we have to act there. And I'm not asking the kid if he wants to go to school or if he wants to treat this medicine. No.
Yeah.
So,
What would you say that window of opportunity is for a kid for like optimized long-term health? This window is really small, and I think parents
it's
don't
very,
realize.
it's a breathing, it's a bit vital function, and we have to go there, no? Because a national function is so important, and we have to live the structure for a grown-up man as you there when he is a kid. Air has to come. We can't ask a kid, well, breathe through the nose, chew with your mouth closed. He's not able to.
Yeah.
So the infancy beyond 6 is unique, unrepeatable, and finite. We finish.
Yeah.
If a kid comes on 7, it's something different. We go with the teeth. Teeth came there in the tongue, and the teeth is there, and so we are like orthodontics, going to fix what is happening, aligning teeth. We need to act before, and this is something very important. No, the teams, the ENT, but. For example, a pupil that came from Colombia, I gave her my online courses that I gave for many years. And her son had surgery of adenoids and tonsils. But first he was okay, and then he started snoring. I went to Colombia and I told her, in this moment, you have to put the appliance and protect them. In this, I came from Colombia in January. The ENT was there, and the kid is perfect. So you need the ENT, but you need to change structure. If you don't change the structure, then the adenoids come again, and the kid keeps on breathing through the mouth. That's why it's a protocol, a whole protocol, where everyone has to create his own team. The most important people is the ENT, but then the functional therapist. So we are in the middle. There are like steps. No, someone says, well, I want to go make Gopex or up locker. No, you need expansion. You need to see an ENT. You need to fill all this questionnaire. So that's why I have a protocol and people do. There is no magic. For my kids that I show in Instagram that they are 20, 25, and they have a treatment, only one treatment when they were 4, mothers work with them. Mothers work with them. It's not magic. It's a work, a chewing method, a posture method. So, but I think that, I work so hard. I travel all around the world.
Very
Doing
a good job.
I have no money, 3 kids living in Argentina. And now I have everything like this. I tell you, look, do this. Well, but Marisa, do it. It's that way. So I give you everything so solved in a protocol. I worked with Sandra, with Simon, so there is a very simple protocol, but you have to do it. You have to do it. The changes this summer, I went to Colombia with all my daughters, my son, because they are physiotherapists, dentists. So I went there and they, my daughter she was a patient 0. They call her the patient 0. And she said, if I don't exist, this won't happen. So I'm very important people. We went to Colombia, and the only thing I receive are mothers saying, look the face of this kid, look how she's breathing, look. That is my office, my consultation. Nobody's saying, oh, she's suffering. Oh, no, this is, but we have to fight to a lot of things, because if some name of aligners, I won't say the name, tells you this is medieval, and a mother crying with a screw and the kid crying, everyone will say, no, I want this aligner. The aligner won't do you nothing to your suture, nothing to your breathing, perhaps aligning teeth. So, well, it's mothers have to be convinced of the treatment. You don't need to convince kids. You need to convince mothers and fathers. The mother is the most important people inside the field. No, I said that this will have to be a standard of care, because if not, all the people would need surgery. To breathe, only to breathe. So, but mothers have to be convinced. And perhaps I'm so convinced of the best thing that I had to do to that kid, it was that I have no problem, but I don't know why. That is something I can't teach. What happens in my office, taking impressions, putting the appliance, no problem, everything, it's okay. Yes, making exercises, parents don't want to, but they had to. I have 3 meetings, and I'm so clear as I'm now. If he's not chewing, well, he has to chew. If he is not chewing, don't do this treatment. Because they say, no, he's vegetarian, she's vegan, he is not chewing. If the kid will not chew, please don't start this treatment. The first day they have to chew. So you have to explain, parents, and they understand, because it is common sense. Common sense. It's not so difficult to think, and I show cases of successful cases. So it's so clear for me and so clear for parents that come to my office. So this is something that the orthodontics world has to understand. No?
Yeah. I guess two questions. When parents step into your doors, will you take me through the process and then kind of who do they start with? Where do you come in? And then what is often said to the parents? You know, does it take convincing or do a lot of them know by the time they're inside?
No, at the moment, people come to me like a kind of, oh, I come to see you from many parts of the world, unfortunately, because it's not happy for me, a mother coming from Israel or Switzerland, because I can't treat them. So that's a problem, no? But so they come to see me. So for me now, it's easy. I create an Instagram. I didn't want to, but I had to. So every pupil of mine says, look the Instagram of Marisa Santos. So they said like that. And now I have refers from pediatricians, from ENT. So the word is changing. It's changing. Believe me, it's changing. But they come and they know what I do.
Mm-hmm.
They don't come. And if they are 7, they come and say, oh, I know it's late, that it's 7. So they know what I do. But instead, I have 3 consultations, but I'm
Yeah.
very 1 hour each. I have a questionnaire, a protocol that they have to complete. Then I'd refer to the ENT. Yes, it's a must. The ENT is a must. I need to know if I can set the girl, close your mouth. She has to have a good airway, no? Then the second, I make some photos and make some x-rays. And then I give them all the treatment. They can come without the kit in that 3rd meeting. And I tell them what we will do. So starting with a book. Well, I start, I pay you. Okay, take this book, a GOPEX book. And the appliance? No. You have to read this book, read it in the family, and then come next week. So we start with the GOPEX book because GOPEX is understanding that the appliance is not the most important thing of all. It's important, but we need kids to do what I was taught. You know, I'm so thankful with my parents because, you know, like I am a crazy woman around the world.
I'm not crazy.
So
You're just good at what you do.
Imagine when I was a kid. So they sent me to an English school. Thanks. That's why I was able to go to study in London and Canada and Australia and all the places where I went. And at school, not alone here in Brazil, you will see me eat, cutting, putting the fork there, putting the ham, chewing, but I do it because I was trained at school.
Yeah,
Yes.
yeah, I know.
Put me something here, you know, and you have to be like this. And nobody went to the school and said, oh, what my kid is doing. No, my mother said, oh, yes, please. He has to be there.
Yeah.
So the only thing that we do with GOPEX is keep straight and shut your mouth. No? But nowadays, kids need a lot of training to do that. So GOPEX is the first time. 30-day challenge, 30 days of GOPEX is before the treatment with appliances. They have to do GOPEX. And then comes the appliances. and then 90 days Copex, and the up locker that, because of Sandra, it's very difficult to get the up locker around the world. In the United States, you have it there, everything. But it's not easy for us to have it. So that's what we now doing, making it more easier for the pupils, because if I teach you this, and this, and you don't have it, well, how you can do it? And the up locker, okay, Engel K, that he created the up locker for snorers. I don't care about snorers. Someone else has to care, but it is a perfect way for the kid to put the tongue, to get the tropic premise. You know that this man, John Mew, for me, is like a kind of, yes, my father created the tropic premise. And you know the tropic premise, what is? Teeth together. Teeth together. He said, the ideal development of the jaws and teeth is dependent on correct oral posture, with the tongue resting in the palate, the lips sealed, and the teeth in light contact for between 4 and 8 hours a day. Finish. And that's not for kids. It's for everyone. So we start analyzing when the kid is losing the tropic premise. Because if you are born with a tropic premise, you have breastfeeding, everything is okay. Then we lose the tropic premise and we start opening the mouth. And then when you open the mouth, you don't have the tongue and the palate, that is the floor of the nose. And this, the nasomaxillary complex, is not growing. That's a problem with the poor posture of the mouth. So we all have to get there to the tropic premise. And I do whatever, if in Switzerland, someone is teaching how to put the tongue in the palate, I will go and learn it, because that is the most difficult part nowadays in the kids. The appliance is not difficult. ENT, I have all the teams, so I have no difficulties. But in this of putting the tongue inside the mouth, there are many things, like, for example, not chewing or breastfeed, the posture of breastfeeding till 5 years old, perhaps, all night. So the posture of the tongue is very difficult to in a 5 years old to re-understand how to put the tongue in the palate. So that is a very important part of the treatment, the posture. The last part of all this.
So will you talk to parents about basically when someone seals the palate and you get negative pressure in the oral cavity, what that does to kind of provide that scaffolding that the device is going to help? But
Yes.
talk about what that does, because I think in my world, two things with athletes. One, if you can get an athlete to feel something, which I think this is great for that, like a child can feel what you're talking about. So now they know what they don't have or what they should feel. And I think the other thing is, like you said, the hardest thing to teach someone is to unlearn a bad pattern. So
Yes.
with kids, if a kid never has to switch from from nasal to mouth and then back to nasal.
That is the most difficult part of all. It's the most difficult part of all, because it does not depend on appliance. It depends on exercises, and there is a complainants of the parents, because you can give a perfect blocker, and if they don't use it, so you know that I have in my protocol
Mm-hmm.
I measure very very easy. Now I'm making a thesis, so I will do it. I will publish that. But we measure the palate at the beginning.
Okay.
We measure the palate when we finish. Yes, now I have a scanner. I bought the scanner only for that.
Okay.
But that's not important because the screw will turn and the palate will grow. In a 5 years old, it's impossible not to have that. But then the most important thing is to measure 1 year after when the kid comes. That is relapse. And if we don't get the tropic premise, we have relapse. That is what John taught us so many times. And, you know, I have a case of 2 twins. And the pandemic in the middle, I put the same appliance, everything the same. And when they come, one was, it was not inverted, but I don't like that palate. And the other one, like a broad palate. And I sent to John and he told me, what oral posture? So how we get there, we need myofunctional therapists trained in this, knowing not what is a function, but what we do when we do nothing, like Sandra says. No, when we are making an exercise. So that is our difficult part in the treatment, is that one, not the appliance, nor the first time, not convincing parents. For me, that is not a problem at this moment. I don't have to, and not the kids, because, you know, if someone sends a message and tell me, you know, Marisa, Lucas is not making the exercises. How old is he? 4. Okay. What will you do when he is 15? Please. So you have to be convinced. We talk to parents, we not convinced, we explain, and not like a silly way. We explain with photos, with Engelke, with John, with everything. I make a PowerPoint for them at the 3rd consultation. I explain everything that they will have, and they have to be convinced. If they are not convinced, I put everything, make a consultation, whatever, but please do not come again at the age of 8.
Yeah.
In the past, I had a lot of those cases. They don't want to make a treatment at the age of 3 or 4, and then they come with everything, make a mess at the age of 8. Now I'm not treating kids of those ages. Not because I'm bad. I'm a good witch. But it hurts. It hurts, really. For me, it's like that. It hurts. I see the magic that comes in the eyes and the cheeks and the breathing of a 3 or 4 years old. That well, I want to do those treatments, and now I have to train people. I have to go there and I have to, my goal is getting more people to be trained, not to keep on treating kids. Everyone, I love treating kids. And John Mew told me, you know, I'm good with kids, but you are best. You are best. And that is something that you don't learn. You know, you don't learn that.
You feel it, right? Little heart.
I feel it. I go here I'm here in the beach, and I go and kids come with a smile. I know what's the problem with that. My daughter, the one that become a dentist, the patient zero, tells me, and You don't explain anything to the kid. I don't say, well, look, I will put this. No. Sit down. I talk with the parent, two impressions, a minute. Well, now we fix the appliance, open the mouth. The parents have to be convinced. We talk with parents, not with the kids. So the difference between making this at the age of 3, 4, and 5, that we create pre-early treatment, on pre-childhood treatment, is focused on the airway. And the airways are important there at that age when the kid is growing. So that's why we are in those ages. And you know that once we went to the meeting in the United States of orthodontists, and we had a there very big saying the early checkup is at the age of 7. So, you know, if you're an orthodontic and you are learning that, well, you learn that. They are telling you that you have to start at 7 or 8. So I think that we have to change those things that I don't know why you say that, you know. So today I have pupils and I told them, I know why everyone is not doing this. And perhaps it's that you're an orthodontist. You start at the age of 8, like, you know, like cooking. You said you give you this, make the cake like this, and you do it. No one is asking. And all the pupils I have today, they are there because of their kids.
Yeah.
And all the pupils I had in Colombia, there were 2 from United States. I have 2 now in United States, from Spain, because of their kids. Everyone was there because of their kids. When you have a kid, you won't wait till the age of 8, you know, if he's not sleeping, snoring, and all that. You won't wait. So I think that you are doing a good job, and we have to be more. I hate Instagram and all that, you know, it's a waste of time. But as a way, I think that if John Mew and those ages had an Instagram, you know, he'd change the world. So,
Yeah.
well,
It's like this. You do an amazing job, and without social media, the world doesn't know about it. And
no.
so through that, you can go learn from the best people. I love Airway because it's like most people don't care. So I was telling my business partner today, I'm like, I'm excited. I look at you as like the GOAT. You're the Michael Jordan early pediatric expansion. So I get to talk to you. You don't get to call up people that are changing the world. And like, I feel like you are part of that change. And if I can't let moms hear what you have to say, like, because that changes things. And when I can put you in front of hundreds of thousands of people, like that matters. And then more people know what you're doing. And then there's pressure here to change. And it's like,
Yeah, the problem I had is of those parents that make an online consultation from countries where have no one there.
yeah,
Latin America, I have people training like pupils that are training others. So Latin America, Argentina, Colombia, Chile, Peru, Uruguay, we have everything there. In the United States, I have 2 that make all the formation, and in Poland. But then if someone in Switzerland, I tell parents, I know where you have to go. And that's when you know, and you start with an Instagram and you know all this, you want that for your kid, you want that because you understand. But what can you do? So that is very frustrating for me when people come from other parts of the world. They said, I go 1 year to Argentina. Well, if you come 1 year, it will be okay. But imagine, no, it has no sense. It's so easy to do this, so easy. And, they said, oh, it's very difficult. But when you have everything done, now my lab is giving like a kind of presentations and lectures for other labs because of the appliance. I have no money for that. It's not that the lab is giving me some prize or some money. No. I do what I do, and I have my money because of what I do. The rest of the people I train, they have their money. So I have a lab, and the lab make a course, for example, for the people in Colombia, because I understood that it was difficult for that labs to make my appliance. So I have everything. So it's not so difficult because I have an online training, and you make the online training, and then you can make the presentation of the cases all during the year.
Okay.
So you can learn. And the lab was a problem. Now the lab is not more a problem. And we are like putting things more easy for the people that want to do it. To come to Argentina, to my pediatric center, well, it's very far away, but I went to Poland to work in a clinic, and so they learn in that clinic. If you want to learn, you learn. And I'm exact example of that. No money, from Argentina, 3 kids that went to the school, they play rugby, hockey, all day going with the kids here and there. And I was able to. Why other people are not? Sandra Khan tells me, you are subnormal. No, I'm not subnormal. I have a life. I have kids. I came here. I love hockey. I go every Saturday with my kids. I came here to see Shakira. I have a life. I'm not subnormal. And I did all this thing. So everyone can do it. And now I have a great responsibility, I can't say, oh, I'm tired, I will rest. No, because I put all this. And so I have to tell you, yes, I give you the interview, although I'm here in Brazil. I don't care. We have
I don't care.
We have to do it, because we have a great responsibility. When you know this, you have a great responsibility. The ignorant has a protraction in the brain because he don't know. But when you know that there is a solution for that kid that is snoring, and the solution is not only going to the ENT, you know that we are creating like big cells in many countries. My protocol is like, for example, now Professor Jesus Rangel, an ENT from Mexico that I learned a lot from him. He's coming to Buenos Aires to put the same protocol there in Mexico. And the same will happen in Spain. And the same, the same. So from here to 5 years, we can have some publications, because the world needs publications. Okay. So I'm very lazy in that. I hate that. I'm not like Sandra that keeps on. I love treating kids. I don't like, but I'm making a great effort for this thesis that I'm making. We are measuring 100 kids with rhinomanometry before and after expansion.
Okay.
And that will be our work with a lot of protocol. It's a hard work, but I'm doing it. And we are having a lot of projects simultaneously, and we will publish. And so then when we published, I will say, what? And now? Because, well, Marisa, you did not publish. Okay. I make a lot of things, but I did not publish. Now I will publish. And so what shall we do with the kids?
I get it. I always tell people, I don't care if someone saves my kid's life. I don't care what kind of car they drive, where they went to school. They saved my kid's life. And I think people feel like you got to keep doing all these things when that's a lot of wasted time rather than just helping people. So when we're publishing and doing stuff that we don't want to do, or we're playing by their rules out there versus just doing what we do, I feel like that was what drew me to you. You remind me of I feel like your clinic, like a Neverland, like little kids just have fun. I love kids, so it's like you don't try to be good with kids, you just like play with them. But I feel like a lot of people have a hard time with that, and they're like, well, what do I do? And I'm like, I don't know, just have fun.
Well, but for me, having fun with them is doing what I do, because believe me that I changed the life. And then the orthodontic life too, because then we are talking about health and breathing and posture and all that. But then orthodontic is easier, not with extractions. You have a lot of space. Perhaps you get one, and you are not a lot of years with appliances. It's like 6 months and all the exercise and the working and the posture.
Mm-hmm.
And so you stop, I'll see you next year. And then next year I decide if we go through another role of expansion or no. My girl has only one treatment when he was 3. And many kids were like that. But that was 20 years ago. Now kids are worse and worse and worse. So 10 years ago, I called the modern kid. My presentation was called The Modern Kid.
Mm-hmm.
The modern kid that has a lot of issues. And now, the thesis that I'm making is called The Syndromic Kid. It's not a modern kid. It has a lot of issues, breathing, posture, eating. So we have to align many things for that kid to grow okay. But I think it's a good thing to do it. It has a lot of satisfaction,
Yeah.
When you call them, please, can you come? I have to take some pictures to you. And perhaps 10 years passed, and the kid comes, perfect, no need of orthodontics, no need of anything. You said, you make a treatment at the age of 3, and then the mother says, I did not come anymore because she is okay, she's breathing well, the teeth are okay, everything is okay. For me, that is the important thing, and the future in orthodontics. I think it's a future.
Yeah. Can you speak to like a 4 or 5-year-old child? Let's just say they come in versus a year later. I think parents oftentimes care about like the expansion, intermolar width, all those things. Can you speak to like a a 4-phase rhinometer from like a breathing perspective? What do you see as that child's posture and their airway gets bigger? I mean,
No. Everything changed. Everything. You know that we are making many studies, but one of the studies I made, that if I knew this, if I knew 20 years ago that I will be now here in this situation, perhaps I would have been more disciplined but I did not care about that. But that now we are with the ENT, we are making a study where we, in adenoids, to A to B, that it's a 3, we are not going to surgery. We're only making expansion and all the exercises, and perhaps the adenoids are not more, because when you start breathing through the nose and change the structure, you change everything. So, and the other way, if you have a surgery, but you don't change the nasomaxillary complex, then you will have again breathing issues. So you know that kids are not, the first thing I do is giving the GOPEX book.
Okay.
Tell them, you prefer a toy or something different, but I will give you this book that will not know now the value of this book, but when you are 25, you will give some sense to this book. And parents are the ones that see the change, nor kids. Kids do what the parents did, and they see nothing. But the changes are for the parents. And when they said, "Oh, I see the diastema, teeth are separate," I said, "Wow, well, perfect." And so this is okay. Yes, it's perfect. So keep on going. Everything is okay, like the face mask. We have a Mexican face mask like this, very little, that it comes from Mexico.
The bow?
And a face mask. The kids are so lovely. They put like they put brilliance and everything to the face mask, and they go to the car and they send me pictures. Yes, you have to be like every week during the expansion and the protraction. If I'm not in Monte Grande, I have them all here. I'm not saying I leave a kid like that and I go, no. Every week trying to put, the expansion, 2 turns, 1 turn, we are like there. Is 1 month, we have to be very near the family, because I know that's why in pandemic, how a government or someone can say to me that I have to stay at home with many kids with the appliance in the mouth, please.
Yeah.
So we have to be there with the families, because I understand that for them, having that appliance in the mouth of a kid, so I have to be there. And I am there for whatever they need. They have my cell phone. So every week they come to my office or they send me a picture. But that's only 1 month, 1.5 months. If something goes wrong, then no more problems. So,
And when you say that, are you talking about like using the actual protraction device? Is there a window where you go at it hard as part of your treatment?
Yes.
And then as far as that, is there like at the end of expansion or at the very beginning, you kind of like, there's that month where every day the protract?
In every case, there is something different, but we use it in the 3rd week of expansion.
Okay.
But in these ages of 4 or 3, the protraction, full, we use it only 15 days.
Okay.
Half a month, then a month complete, and 2 months as a lot of time. But the real protraction is there in 15 days after the expansion. So
you tell parents like what protraction does and why it's so important as part of your treatment?
Yes. I explain parents. I think that my parents know more than many professionals, because I explain them, but with the tropic premise, with the angle kiss, with sutures and showing I have a skull there, showing what we are doing to the kid and why he will breathe better. This is not magic. We'll breathe better because we are going to the sutures. And perhaps the mother, the day we give the face mask, one mother was crying. Oh, you don't have to cry. This is the best thing that can happen to your girl, you know. So
Yeah.
but I think that because I have so many experience of so many years doing this, inventing this. Now, yes, I'm Marisa Santos and everyone knows me and it's easy, but I'm doing this in my girl. She's 26. So imagine when I did this 20 years ago, I was a real witch situated in Monte Grande, 30 kilometers from Buenos Aires. Now not, because everyone saw my work. I'm at university, I'm the Society of Orthodontics, and those institutions give me what I need as an orthodontist. I never want to go out from the orthodontic career, you know.
Yeah.
Last year, once when there was a congress, an international congress in Buenos Aires, and no one talked of a little kid, I put I will go out from this institution, you know, because I'm a crazy woman. So they said me, no, Marisa, come here. No, I can't believe I'm 10 years talking about this and no one talks about a kid of 4 years old. So we have to get involved with institutions that talk of this. And I'm the society, Argentine Society of Orthodontics, you know, it's very important in the ranking in the world. It's a very important institution. And I'm there. I'm not like a witch making things out of the system, you know. I'm still inside. I'm at university, being chief of the most important orthodontic career. So that gives like a kind of sense, because if not, the pediatric dentists and all that people, they need an orthodontics to set, they are under my umbrella.
Yeah.
So I think that this will be the future. I see all the people struggling because of the airway and people snoring and people using CPAPs and or the 3-4 times orthodontics treatments. You know that? And so when you do this, when you create maxillas, you don't create, you put the maxilla where it has to be. You're not creating anything. You are putting the maxilla where it has to be. If it was not because of the thumb sucking of the pacifier, because of the bottle feed or whatever it was, you put the maxilla. So the teeth come there. They come there. You don't have to put something, a kind of wire to align them. So that is, for me, what we have to do in the future.
100%.
I think that this has to be in the universities, in the degree. When you become a dentist, someone has to talk about this. And in the orthodontics career, of course, no? Yeah. It's very difficult for the governments to take care of this because it's very expensive. Not as in United States that you charge a lot of money to the treatments. We can't do this in Latin America, but we can do a good treatment and have a good life. Because people says, well, but it does not give money. This is not giving money. Well, I don't think so. First, I have 3 kids. They went to school, they went to university. I gave a car to each of them, and I study all around the world, paying my studies. So I can't say it was bad. It was economically.
Yeah.
I think no. So I don't think so. If we talk about money, because people care about money. So I never care about money. I did whatever I want without caring about money. I care about the kid I have there. But as for more people to do this, you have to tell them that they can live with what they gain of the work. So that's why I talk of money. But I think that we, in this last years, we kind changing the world, but what we described many years ago, this of everyone will need surgery, this is happening.
Mm-hmm.
And authors are saying, wow, it's not like I was an author that only straightening teeth. Cases are so dramatically, so difficult to treat, that when they see in a magistrate that you can do this in a kid, you will do this in a kid.
Yeah. You're like, why wouldn't we start with that? Makes my
Yes, we
job a
have
lot
to start.
easier.
Of course, someone has to know how to treat those surgical cases, because
Yeah.
you or many people need whatever they need to have a good face, a good appearance, a good airway, and that's good, no? But for the kids, someone has to treat them. We can't say that they have to wait. Waiting is going to extractions or going to surgery, and we don't want that.
Yeah.
So
Yeah, there's
there's
a
a
Dr. Joseph De Cruz. He's out of in Australia, kind of lives kind of in the sticks, but 70-year-old guy, and he's just like, the best healers in the world don't care about money. They're not businessmen. They just want to help people. And he says, same thing. I get this sense from you of like, why would I want to retire? Like, I love what I do. It gives me purpose and it's my passion. I think so many people are about money versus if you do what you love and you change lives, like there's nothing better in this world.
so I had a very clever partner that once said, you never did anything because of money, and the money came to you, the money I need to
Yeah.
live, to make this pleasure of coming with my 2 kids to Brazil, to take all my team to Colombia. The money comes for the thing I need. And retiring? No. I think I have to be I have to die there with all my kids in my pediatric center. That's the only way, no? But yes, having a purpose is so important in life. And I think that we have a purpose. And my purpose now is getting more orthodontics to be trained in this, no? This is and they won't listen to this in an ortho meeting. There has to be meeting like this in
Yeah.
Colombia, because in ortho meetings, no one is talking of this. So, and the pediatric dentist is the one that the kid comes um, at the age of 3. So pediatric dentists are a lot of learning this. And I allow in the Society of Orthodontics pediatric dentists to make all the 2 years that they are trained there. So a pediatric dentist trained during 2 years to make
Hmm.
this first part, although orthodontics said, well, no, because they are pediatric dentists. Please, you do it? No. So if you don't do it, if no one is doing it, let's allow pediatric dentists that want to be trained to do it. If they are
Yeah.
trained, they can. So the two students of United States are pediatric dentists, but they were trained. So if they are trained, they can do it. And we are going, I think that pandemic was very helpful for this spreading of information.
Mm-hmm.
And now things are getting more quickly and quickly and quickly. And many people they have this need, but because of parents are coming to us telling, look, I have this problem. My daughter is with an open mouth posture. These are my consultations. They come to me for that. So, and well, we need people like you, working in this and with Instagram, YouTube, I don't know what, but making this. Yesterday, I have a live with a Colombian pupil, and she's making a congress in Colombia, and so and she says it's a very hard work holding a congress, like for me, holding the symposium, but it's the only way to mix pediatricians, ENTs, myofunctional therapists, anthropologists. They're all together to learn or to change their mind, no? So I think that we are all in the correct way. And we need people like you spreading this and saying things in Instagram, for example.
Yeah, I feel like because I'm not in the world of dentistry and orthodontics, I can say whatever the hell I want and I don't care. But like, I want to bring this into health and performance with athletes, and I think all these kids with just all these learning disabilities, it's all just a brain that needs more oxygen, doesn't sleep good, immune system, but it all comes back to what you do. And like, most people just they don't understand that it does. And they don't understand, because it's so important, getting it right in the very beginning is critical. And the sooner we kind of intervene, it's like smooth sailing.
It's something totally different. It's not the same. I said with new words, because young students to understand. I said a green flag is a 3, 4, and 5. A green flag when you have everything good. When you have 6, 7 with no teeth, the deciduous teeth, all deciduous teeth, perhaps yes. 8, 9, and 10 is the worst age for a kid to come for a consultation. Because then when he's an adult, an adolescent, well, surgery, whatever.
Yeah.
But in those ages, when you want to fix the kid, but you are not able to because teeth come here and there and it's a mess. And all the time, the mother went here and there saying the you can't say the R if you don't have space for the tongue, So sometimes kids, if they can, they had to raise their hand and said, are you stupid? That are you trying me to do things I can't do? Some kids come with I don't talk about malocclusions, no, I talk of craniofacial abnormalities. But imagine a kid with a crossbite 2 times, an open mouth, and going to the myofunctional therapist and having a spray. Please, that kid has to tell us, are you stupid people doing, I can't do this. I can't, really, I can't. If they can talk, poor kids, And so when you are a mother or a father, you have the responsibility of that kid. But the problem is finding a professional. I think that this has to be like I talk. We are countries where we play football. And so I talk like a pediatrician has to be like the DT of all the team.
Yeah.
The pediatrician has to tell me, look, put an expander, put an appliance. Inside the field, we need a Messi, or put
I don't know what
Messi.
Messi is.
Messi will be the family inside the field, no? Because we need that family. The kid will not make a video of Gopex himself. No, we need the family. And then we have many other players there, like the ENT, the pediatric dentist, the myofunctional therapist, the osteopath. We have all those people. And the transdisciplinary work is I send the ball to you, but I know what you do. I can't send the ball to you. I know whatever the ENT makes. No. I have to know. That's why I have a transdisciplinary protocol. With a transdisciplinary protocol, the mother goes to the ENT here and there, everyone talking about the same thing. That is a transdisciplinary way. It is held by me, for example, but it has to be held by the pediatrician. 20 years this time, that will be, for me, in my dreams, that will be a standard of care for oral kids.
I mean, I know on your website you have a quote from Dr. Gimino at Stanford, like about the transdisciplinary and like the siloed effect of modern medicine. Like, how did you get to where everyone sits in one building? Because I was telling my client today about that and how it's brilliant, it's effective. Your best athletes in the world have a team of doctors that sit down and do what you're doing. But like normal people don't get access. And then we just chase our tails going from doctor to doctor rather than everyone
Yes.
sits to what's in the best interest of this person, what's my role, who's the quarterback. Like, but that
No.
makes sense. How did you or why did you kind of go there, and was it hard to do?
The thing I had easier was a pediatric center. I have a pediatric center, so everyone was there. I had for the very beginning, I had an ENT. So I learned we meet, we are still having meetings. So I tell the ENTs what I heard in the world. And so my group of people is very simple because I have a pediatric center, but I understand that the other dentists, orthodontists, don't have a team, a pediatric center. They are alone in four walls. So a friend of mine at Chile, she says, take a coffee with the ENT of your city. So the first thing you have to is to talk. You know, I was very young and I came with protocols from all around the world to boys, doctors. And so I said, who you are? A dentist? A dentist and a woman, you know? So that's why I use this protocol. I talk to the doctors. Now that doesn't happen to me. But to my pupils, I said, well, first you have to get an ENT. And the ENT has to watch my Instagram. And for example, I went to Colombia and there were many ENTs. ENTs invite me to conferences. So first we have to get the ENT. And then you have to get a myofunctional therapist. And at the moment, and for many years, for more than 15 years, the transdisciplinary protocol it starts in my office. It starts there.
Is that how medicine is done in Argentina, or is that like just your location? Is that the standard of like throughout the country? No. Okay.
It's in my pediatric center at university where I am, all my pupils that are doing the same in the society, Argentine Society of Orthodontics, but in Argentina, yes, because many, not only Argentina, Latin America, there are many people trained in this way.
Yeah.
And then Poland was, I went there for a symposium of John Mew, and Poland, 5 orthodontics get me first. And then I went to work in a clinic. And in Poland, this is going along.
Yeah.
They have teams and they have groups, and they make a transdisciplinary protocol, conferences, and they invite me, and I enter like I am, Lady Gaga, entering 2 hours, but they are going along. Poland is going along. They are very disciplined people. So they make OPEX, and I work there. So Poland is going along. United States, no, we need more. There are a group of people working there. So in little kids, but we need an orthodontist to do this. And Sandra is an orthodontist, but she's not now treating kids, there. We need someone that is treating kids, because I think that when you are not treating kids and knowing what's happening now, it's not the same now than 6 years ago.
Yeah.
John Mew, you treat in London 60 years ago. Come here and be with these mothers that now we have the kid that wants to do whatever he wants, and no, when he decides, no. So we need people that are that, but I have this too, and this too will start 2 pupils in the United States, and they will start. We can, if you have someone there in the United States, I can get in touch with them. That they were very good pupils, and they start doing this. They are not orthodontics, they are pediatric dentists, but anyway. So there's another group of people doing this, like Kevin Boyd. I met him many years ago.
He's awesome. Yeah.
Met him many years ago. So, but we have a community, and before pandemic, we have a community that gather us, that was called Academy of Applied Myofunctional Therapists. Mark Mueller invited me there. And so we start and we make great conferences. And then pandemic come, and I know what happened. So we have to gather again a group of people that are people making different things, not the normal things or the common things. Anthropologists. I learned a lot of anthropologists. I had the pleasure of being there and hear all of them. Anthropologists, physiotherapists, myofunctional therapists. So all together. That's why the symposium I will held in Buenos Aires, I don't know how I can put so many people to talk there, but it will be about this. ENTs, early treatment, airway, many people around the world. So I think that we can help many kids, but the thing that happened to me now is not having a referral to say, this kid is talking. I have a map in my Instagram, I have a map. And so everyone says, but people has to give you money because you send patients. No, I don't need that money. I need someone to treat them there, here in Colombia, here in Chile, here. I need that. I need that map to be bigger and more people to refer, Go there. 2 hours ride, you are near. Believe me, you don't have to come 1 year to Buenos Aires. You have to go there. And so that is what I'm I have my focus now, training orthodontists. So
I got it. Yeah, my biggest thing is going to be the day I release this video, and then I'm going to have 700 moms like, where do I take my kid? I'm like,
that is a problem. And my
yeah,
Instagram explodes, and I don't know how many people at the moment in my Instagram saying, yes, I'm from, I don't know, where can I go? Don't you have someone here that makes that? And you don't imagine with orthotropics and everything that John makes, because I'm there situated in a map, because I went and get my diploma there in London. I went 4 times to study with John. So, but I'm not making that with grown-up people, and they are driving me crazy with that. And we don't have many peoples to refer, and that's a problem. That what you said is a problem. You will have 100 of consultations of mothers that go to the pediatrician. He's not her like this with the open mouth posture. Where can I send my kid? So you also have to have a map of airway dentists, orthodontics, no? But we don't have so many. We don't have so.
yeah, and I think
I
I'm often left with there's doctors down the street, but in my opinion, based on their philosophy, they don't approach it very well. And then I'm like, I don't want to send someone there. And then it's just like parents don't know what they don't know and the approach of the doctor. So it's like without
correct.
bashing people, but like knowing that like distinctions matter, philosophy of the doctor matters. So I'm not going to send you there. That's why I don't have a list because people get mad that they're not on the list. So I'm like, well, I don't agree with how you do things. And I'm okay with that. You're not.
Yes, but the only thing I I agree with you that we have to make this kind of things, and we have to um, notice and mothers telling. One mother wrote me yesterday, who will help these mothers? Yes, we have to help mothers, but I don't have orthodontics for what will happen after you put this, I don't know where. I didn't ask you where, but that will happen. And that's my problem now. Look, I can't respond all the consultations. I don't have doctors. And the
Yeah.
ENT says, I need a doctor that makes what you are making. And I said, I know in that country, I don't have any. And it's a very, when you know that and you're far away, it's very, if you know that you can do something and you see the cases in my Instagram or whatever, you want to solve the problem for a kid. That happened to me one Sunday before coming here with a mother. Sunday, making an online consultation, she was desperate. And she told me, I can sell my house to go to Buenos Aires. Please give me someone. And I tell her, where? In Barcelona. It's 4 hours away. 4 hours away. It's not good. People are taking planes to come and see me. That's not good. You have to have a near contact with the appliance, with the mothers and fathers. 2 hours, okay. 3 hours, okay, but not a plane and, so many things.
Yeah. Yeah.
So that is, the last time I changed my website, it was for professionals, not for more kids to come to my office. Although I love kids to come, I need to train them, need to train professionals. So, but I don't know how to do that because we change everything and
Yeah.
it was no, okay, more kids and more kids coming to my office. And so I want to get there to the orthodontist. For the orthodontist community, please This is something so easy. So, or perhaps you don't love kids, you don't want to manage, but you have a pediatric dentist that, yes, and is able to do the first phase. And for the orthodontist will be easier, you know, not so complicated. So that is something that we have to get. But I think that we are getting where we have to be. So this is going.
Yeah.
And I have a lot of pupils that have to train others, because I can't be the only one that is training people. There have to be more people.
Yeah.
You know? My trainings till now were personal trainings. I don't love those.
Yeah.
Because I don't care about money. I don't like having 100 people, no one doing the protocol.
Yeah. Yeah.
I want one asking me everything you want in private. So you can tell me, look, doctor, how can I take an impression in a 3 years old? Doctor, how can, so I'm one, now I have three, no more. And so we are groups of 3 training. Or more. I don't want to put this online and people learn, because they won't learn. No, they have to have the lectures and everything, and the philosophy and why we are doing things. If you're doing OPEX, you have to read the articles, you have to give an exam. It's not like doing, you know, well, I take a photo of your appliance and I put it. No, it's not like that. I don't want people doing that, you know? I want people that study. So now we have other things. I had to waste a lot of money going to all the countries. You imagine to learn. Now we have online. We can't imagine this before pandemic. Now we have it. We can learn and we can do things online. So please, doctors.
Please. No,
Please.
I feel the same way. Like I'm going to, my doctor invited me to his seminar next month in Kansas City for my TMJ. And I think he's one of the best in the world, Dr. Rahman, the Rahman Center, and how it's like, how many people he's helped, like girls, 30, 40, 50, chronic TMJ, neck pain, jaw pain, and how it's the same thing. What he does is, it's so nuanced, and it's a lot of learning, and like people want the money versus to go learn. And it's like the world needs more of what he does, because it doesn't exist. And I think that's the hardest part, right? Is you talk to these people all over the world and you want to help them, and you're aware of this gift, you are doing it. And I think if you can't put it in the person's hands that needs your help, I mean, it's heartbreaking. And I'm grateful that I have money. And like before I started just my suffering, like I could get on a plane and go see the best in the world, but most people don't have that. And I think with what you're doing, you can give a child health for the rest of their life based on first 5 years of their life. If you protect nasal breathing, posture, you protect and you set a child up pretty much for life. And I think that's critical what you do.
Yes. And that is something that has to be expensive than making a surgery, an orthodontic surgery, but it is not. Although in United States, doctors that are doing this, they charge a lot of, and it's okay. So this will change lives, but it's not like, oh, I'm so passionate. And no, it is like that. You change lives. So perhaps parents don't know. My ex-husband told me, what you are doing is like believing in Jesus Christ, because you know what will happen because you are an orthodontics, but parents never imagine what you did there, what they have paid not to be in this situation of orthodontic surgery at the moment. They never I don't care. I don't care if they don't know or if they don't understand. I know, and I am the doctor. I am the one that is responsible not to putting this child in all that treatment afterwards. So,
Yeah.
but it's like that. They don't, I show cases that you can't even imagine what will happen to that in the TMG, wherever, to that little girls that I treat 20 years ago at university for less than, I know the amount of money. And now they are perfect in their lives, because this is best for people that have no money, because you save a lot of money, not only all the problems, but also a lot of money,
Yeah,
because
like
it's
what you do would bankrupt most medical insurance companies because we wouldn't need it.
no, we wouldn't.
80% would go away.
Yes, yes,
Asthma, ADHD, it's like none of that. No CPAPs, gone.
no, no, yes. Well, so many things to be done.
Yeah. Well,
Uh,
I want to thank you. I don't know, like Zoom, first time I've ever done this. So as far as like shutting off from the recording, but like, I guess, yeah, I'm grateful for the work that you do and the fact that like you're great with kids. And just when I see pictures and videos of like kids laughing, it's just like, I feel like you make it this environment that's fun and it's inviting. And I think when you invite kids into your world and it's fun, like they want to make you proud and happy. And I think this is probably why you're so successful and you're able to do what you do. I guess kind of want to finish with like any kind of last words as far as like, kind of where you see the future of orthodontics or anything you kind of want to add.
well, you know that I think that everything is going there, and we will have an impact, because really, 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 orthodontic cases and breathing issues are very, very, very dramatic. So I think that once we realize in 2 or 3 years, we will go to this, and this is easier. We are changing lives, really changing lives. We are not putting extractions, mutilating people. So I see that this is a future. I'm saying it for many years, that this is a future in orthodontics. I don't think that the other thing is a future. And perhaps institutions don't believe, or perhaps they believe. I don't know. I don't know what is happening, because I want to talk in the AAO for many years, and they said we are not interested. So I don't know, but no matter. I think it's a future, and it has a lot of your heart would explode when you see those mothers that don't know what to do, how kids change. And when we are parents, we know what we want. My daughter had a friend in the hockey team that was like this. And so she had to go for surgery. And she told me, Mommy, if you did not make me this treatment, I will be like her. Yes, yes. And with problems, and with breathing problems, and cannons impacted, and so many things. So I think that this is a future. I believe in this. Truly, I believe in this. And it's so easy to do it. And it's like saving kids from many, 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 many things. And I think that perhaps in many years, this will be a standard of care in many countries. I think so.
100%.
I
Well,
think so.
thank you very much for coming on today. I really appreciate it. You do amazing work. It's cool. Like that's why I love the internet. You get to Some people just scroll, but like to learn from the best, to watch the best and how they're doing, it's cool. You do great
Wow.
work.
Well, thank you for this so amazing interview.
Yeah, yeah.
So thank you very much.
Have a good weekend and a good Valentine's Day.
Well, I'm returning to Argentina to work with more kids.
All right. Well, thank you for coming on.
Well, bye-bye. Bye.